Allergist or immunologist. They treat immune system disorders such as asthma, eczema, food allergies, insect sting allergies, and some autoimmune diseases. Becoming an allergist or immunologist requires at least an additional 9 years of training beyond a bachelor's degree. Allergy or immunology is an internal medicine or pediatric subspecialty. Clinical allergist or immunologist treat people who have allergies or immunologic diseases. They usually work in private or state run healthcare facilities. Allergist or immunologist can choose to focus on treating or researching other medical subspecialties in addition to allergy and immunology. These can include general or transplant surgery, autoimmune diseases, infectious diseases, oncology. Anesthesiologist. These doctors give you drugs to numb your pain or to put you under during surgery, childbirth, or other procedures. They monitor your vital sign while you are under anesthesia. They care for people after major surgery in the intensive care unit. They also help people who have serious pain from an injury or chronic pain, such as ongoing back pain, within a pain management team in the hospital or in an office setting. Anesthesiologists also have an important role in take care of people who are having minor surgery or who may not need to be unconscious with the general anesthesia, such as people in labor ready to deliver a baby.
Cardiologist. They are expert on the heart and blood vessels. You might see them for heart failure, a heart attack, high blood pressure, or an irregular heartbeat. A cardiologist will do a physical exam and discuss your symptoms, medical history, and family history with you. It's important to let your cardiologist know if other people in your family have had heart problems because that can increase the chances of you having a heart problem. Colon and rectal surgeons. You would see these doctors for problems with your small intestine, colon, and bottom. They can treat colon cancer, hemorrhoids, and inflammatory bowel disease. What does colorectal surgeons do? Colorectal surgeons practice the full range of endoscopy and surgical techniques for treating your GI tract. That means they have all the available tools at their disposal to treat complex conditions. They can treat you non surgically with minimally invasive surgery or with open surgery. Critical care medicine specialist. They care for people who are critically ill or injured, often heading intensive care unit in hospitals. You might see them if your heart or other organs are failing or if you have been in an accident. A critical care medicine doctor is also well versed in the technological procedures and devices used in intensive care settings as well as issues such as end of life decision, advanced directives, estimating prognosis, counseling of patients and their families. Dermatologist. A dermatologist is a medical doctor who specializes in conditions that affect the skin, hair, and nails. Whether it's rashes, wrinkles, psoriasis, or melanoma, no one understands your skin, hair, and nails better than a board certified dermatologist. If you were to watch a dermatologist at work on any given day, you might see them treat a baby's prominent birthmark that threaten the child's eyesight, remove a mother's deadly melanoma at its earliest, most treatable stage, offer relief for a student whose chronic eczema makes sleep nearly impossible, diagnose the life threatening liver condition causing a grandfather's unbearable itching, treat the hair loss of a young woman, helping her gain the confidence to search for a job. Endocrinologist. These are experts on hormones and metabolism. They can treat conditions like diabetes, thyroid problems, infertility, and calcium and bone disorders. Disorders and disease that originate elsewhere can also end up causing symptoms in your endocrine system.
When problems in other systems or body parts impact your endocrine system, an endocrinologist will work in tandem with your primary care doctor or other specialist to come up with a treatment plan. Emergency medicine specialist. These doctors make life or death decisions for a sick and injured people, usually in an emergency room. Their job is to save life and to avoid or lower the chances of disability. Emergency medicine specialists are the one who meets the patient first at the time of emergency. They are expert in dealing with emergency cases so that patients can have a care and quick treatment. Family physicians. They care for the whole family, including children, adults, and the elderly. They do routine checkups and screening tests, give you flu and immunization shots, and manage diabetes and other ongoing medical conditions. Family physicians, through education and residency training, possess distinct attitudes, skills, and knowledge which qualify them to provide continuing and comprehensive medical care, health maintenance, and preventive service to each member of the family regardless of gender, age, or type of problems, be it biological, behavioral, or social. Gastroenterologist. Gastroenterologists perform the bulk of research involving gastrointestinal endoscopic procedures as well as the interpretation of results and are considered expert in the field. They are specialists in digestive organ, including the stomach, bowel, pancreas, liver, and gallbladder. You might see them for abdominal pain, ulcers, diarrhea, jaundice, or cancers in your digestive organ. They also do a colonoscopy and other tests for colon cancer. Geriatric medicine specialists. Geriatric medicine specialists are generally family medicine doctors or internists who specialize in the diagnosis and treatment of conditions and disease of older adults. Geriatric medicine specialists can diagnose and treat many medical and surgical problems and can refer people to other specialists. What condition does a geriatric doctor treat? Geriatric doctors have expertise in many of the age related conditions and illnesses that older adults face. Hematologists are internal medicine doctors or pediatricians who have extra training in disorders related to your blood, bone marrow, and lymphatic system. They are a specialist who may work in hospitals, blood banks, or clinics. Hematologists who practice in lab are called hematopathologists. They are trained in pathology, a branch of medicine that examines body tissue and blood with microscope or test. Infectious disease specialists. They diagnose and treat infections in any part of your body, like fevers, Lyme disease, pneumonia, tuberculosis, HIV, and AIDS. Some of them specialize in preventing medicine or travel medicine. What does an infectious disease doctors do? There are dozens of infectious diseases from the flu and pneumonia to the common cold. Infectious disease doctors are trained in clinical and laboratory skills to make the right diagnosis and organize the best treatment plans. Internists. These primary care doctors treat both common and complex illnesses, usually only in adults. What does an internist do? Many internists treat people for a wide variety of illnesses. They are called general internists and they typically see people in the office. They manage chronic illnesses and often they have long lasting relationships with their patients. Some internists only see hospital patients. Others may work in different care settings, such as rehabilitation facilities or centers for hospice care. Some go into research and others choose to become administrators. Medical geneticist. Medical genetics is the branch of medicine that involves the diagnosis and management of hereditary disorders. Medical genetics differs from human genetics in that human genetics is a field of scientific research that may or may not apply to medicine. while medical genetics refers to the application of genetics to medical care. For example, research on the cause and inheritance of genetic disorders would be considered within both human genetics and medical genetics, while the diagnosis, management, and counseling people with genetic disorders would be considered part of medical genetics. Nephrologist. A nephrologist is a doctor with expertise in the care of kidneys. Your kidneys are part of your urinary system. They are being shaped organs that filter your blood and remove waste, excess water, and electrolytes which leave your body as urine. What does a nephrologist do? A nephrologist diagnoses and treats kidney conditions and kidney failure. In addition, they also recognize how kidney conditions affect other parts of your body, including autoimmune diseases, cardiovascular diseases, high blood pressure. Neurologist. A neurologist is a medical doctor who diagnoses, treat and manage disorders of the brain and nervous system. A neurologist knows the anatomy, function and condition that affect your nerve and nervous system. Your nervous system is your body's command center. It controls everything you think, feel and do, from moving your arm to the beating of your heart. How do neurologists diagnose conditions? Your neurologist will ask about your medical history, family history, medication history, and any current symptoms. They will also conduct a neurologic examination, including tests of your coordination, balance, reflexes, and gait, muscle strength, mental health, vision, hearing and speech, sensation.